This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, we've been told all of our lives that the keys to staying in optimal shape are simple: diet and exercise.
Diet part is pretty basic: low fat, low calorie foods, plenty of fruit, lots of veggies. So let's talk about the exercise part. For a lot of people, they hit the ground running, literally.
I know I do.
She
In
does.
fact, I guess I would consider myself an avid runner, but new research calls into question the actual benefits of running.
The study, conducted by the Cardiovascular Research Institute at the Lehigh Valley Health Network, found that people who either get no exercise or those who are high mileage runners both tend to have shorter lifespans than moderate runners. Moderate meaning a total of 2 to 3 hours a week. Now, most of the study participants reported running more than 20 miles a week.
And researchers aren't sure of the factors that led to their conclusion, although they do say the study rules out cardiac risk and use of certain medications such as common painkillers as factors. One doctor who reviewed the findings says there may be simply too much wear and tear on the bodies of high mileage runners.
Now, although the study findings are still considered preliminary, they certainly raise the question: is more really better when it comes to physical activity?
Well, joining us today to share some insight on that is Molly Ryman, an exercise physiologist with Peninsula Regional Medical Center. Thanks for joining us this afternoon. So I have to ask you, is more really better? I mean, can you exercise too much?
Well, you just want to be careful with your exercise and make sure if you have joint problems or arthritis that you're taking care of that and exercising in moderation so you don't cause a flare-up or injure yourself further.
Now, we hear about people that do marathon after marathon after marathon. Is that a pretty big impact on our body? Is it a bad thing?
Well, running is high-impact exercise, so
Right.
it's a lot of pressure on the joints, the hips, knees, and ankles. So as long as there's adequate recovery time and proper training ahead of time. And
What about people who maybe aren't used to running and try to go out there and just the first thing do a 5K race?
Well, I always suggest that you start with a walking program, especially if you're new to exercise and you've not done any running before. Always start with walking and then gradually build up your exercise tolerance.
Okay, so there are those that believe that running is better than walking. Any opinion on that? Is walking better than running?
Well, not necessarily. If you were to walk for 30 minutes versus run for 30 minutes, you may not burn as many calories, but
Right.
you're still getting the positive effects of exercise and you're still lowering your risk for heart disease and diabetes. And you know, if you're someone that has joint problems, it is better for you to do a walking program.
So it can be just as effective, just might take a little longer.
Yes.
All right. Now, in the study, researchers ruled out certain types of medication as being a factor, but can medications impact us if we're running, exercising?
Well, if you do take regular medications, like for blood pressure, for example, then it's always good to consult your physician and check with them to make sure you're doing an exercise program that's safe and healthy for you.
Okay, so we're talking about exercise here specifically. What happens to our bodies if we don't exercise at all?
Well, you have a more increased risk for getting different diseases like cancer and diabetes and heart disease. So even if you can only do 10 minutes a day to start, that's definitely better than not doing any exercise at all.
So what types of exercise should we start off with if we're implementing it into our routine?
Definitely walking is number one. It's cheap and easy, and you can grab a nice pair of walking shoes and a friend and walk around your neighborhood. That's the best thing to start with, and always try out an exercise class as well. Most facilities in the area will allow you to try out a class and see if it's something that you like and pick something that you enjoy to do, because it'll be harder to stick with it if you don't.
A lot of people have such a hard time working time into even walking and running. Is there something we can do, like just around the house, around the office, that would help?
Yeah, you can certainly do just marching in place, getting up from your desk and moving around, stretching, doing some push-ups are one of the best exercises you can do.
Right.
Going up and down the stairs, trying to take the stairs versus the elevator, parking
Okay.
further away in the parking lot. So doing little things.
If you can find the time, what is the ideal amount of exercise?
Daily recommended is 30 minutes per day, 5 to 7 days a week of aerobic activity to try and get your heart rate up. Always try to work hard so you're burning your calories and building up a good sweat. Okay.
Is it ever too late to start?
No,
No.
never too late to start. No.
All right, Molly, thank you so much.
Thank you
for
very
coming in
much for
today.
having
Great
me.
information there.
And if there's any questions, of course, always ask your doctor. And to read more about fitness and exercise programs from PRMC, go to delmarvalife.com and click on the show tab.
Okay, so there you go. We covered your physical health. Now, what about your mental health? You know, sometimes we need to take a lesson from our kids. Just get away. A week at camp would do a world of good, wouldn't it? Well, we're going to learn about a place called Camp Powerment, where adults are welcome to whisk their worries away.
Oh, yeah, and I'm sure you'll have fewer worries once you get that tax refund back, right? Mm-hmm. We'll find out how to make the most of that extra money.
But first, we just learned about exercise. Before you get moving, though, Dr. Oz says make sure you're in the proper environment.
Hi, I'm Dr. Oz. The air we breathe is like food for our lungs. In addition to secondhand smoke, air pollution and toxic substances have been linked to higher incidences of lung cancer. So check air quality levels in your area and avoid exercising outdoors when pollution is high. Also, avoid burning wood and trash near your house.